Hello, my name is Tori Ellis. I've been a registered nurse for 8 years now. 7 of those 8 years I have spent in the United States Navy as a Navy Nurse Corps officer working in Navy medicine. In the other 1 year, I have spent working in case management. I have one son and I'm married, and throughout the years of my nursing, I have learned, to me, the most important concept is to do no harm to my patient. I first look and think about the fact that when a patient comes to receive care, they are in a vulnerable state. And that being said, the patient and the nurse have a professional agreement on which, in this agreement, I feel that the nurse is required to support her patient in any way that is appropriate to help with the patient's condition. The nurse must function as a professional to protect the patient's needs. A patient is someone who is unable to take actions in order to survive or fulfill their needs on their own. So without the patient, I feel there is no nurse. And as a nurse, I have to act as a patient advocate. And again, as I stated, there is an agreement between myself and that patient that I am going to act on their behalf. And then comes the principle of benevolence, where I'm inclined to do good. And that being said, I feel like that's one of the most important ethical qualities of a healthcare professional. And this is what actually motivates me to act on my patient's behalf. And again, to make sure that I'm doing no harm to the patient. I understand that in the act of benevolence, I have the ethical understanding that my actions should be for the good of the patient. And also, then comes the concept of beneficence, where I'm required to act on a way that benefits the patient. So, in my career as a nurse, I have learned that being that patients are in a vulnerable state, many times they're unable to speak up. And as a nurse, I have to speak up for them. I have to advocate for them. I have to act on their behalf. I would feel personally responsible if something were to go wrong with the patient, and it's something that maybe I should have done or could have said. So again, the basic concept for me, and one of my most important philosophies, is to do no harm. I've spent, again, 7 years providing care as a Navy Nurse Corps officer, and I've cared for many of the wounded that came back from war. And many of them were both psychologically injured as well as physically injured. And I had to be an advocate for them on many levels. And I realized that while providing this care, patients were entrusting in me to do the right thing. They were entrusting in me to make the right decision. And they were entrusting in me that I was going to, make sure that they were healed appropriately and that they resumed as close to their normal state as possible. Not only do we have that right to the patient, but we have that right to their family members as well. So, again, to do no harm is my philosophy in caring for patients and my philosophy in nursing.